What if I told you that some changes in our breast can actually be an indication for serious health complications such as breast cancer? In today's video, I'm going to be uncovering some of those signs and symptoms we should look out for and that we should never ignore in our breast. And also, it's important for us to know what we are looking for so that we can actually tell when we see these changes. The breast is composed of fatty tissues, connective tissues, the milk duct, and then externally we have the nipple, which is the protruded area in the center of the breast, and then surrounding the nipple is the areola, which is the darkened or more pigmented area on our breast. And just like any other organ in the body, the breast has its own blood supply as well. It is important to know that hormonal changes that occur during menopause, pregnancy, or even menstrual cycle can actually affect how our breasts look in terms of size and tenderness. But not all of these changes are actually harmless, and we need to know which one is harmless and which one is not. Now, let's discuss these common changes and when you should see a doctor. The first sign that you should not ignore is a breast lump or mass. These lumps can be like a cyst, which is like a fluid-filled sac on your breast, which are usually benign, or it can be hard, it can be fixed, it might be painless. So however it is, if you notice a lump in your breast that was not there before, it's important to have it checked by a doctor. Another sign not to ignore is a sudden noticeable change in the size of your breast. It can be one of your breasts or it can be both of them. It's also important for us to know that the breasts are usually not of the same size. One is usually a little bit bigger than the other ones, but these changes are kind of hard to tell. If you look at the breast, you might not really tell that one is bigger. But in cases where there's like a sudden noticeable change or swelling in one of the breasts, it kind of rings a bell and it's something that needs to be checked out as well. Another breast change not to ignore is skin changes in the breast, such as dimpling, puckering, redness, or rashes around the breast. If you notice any of these symptoms, it's also important to have it checked by a doctor, as it can be a sign of inflammatory breast cancer. So if you notice any of these symptoms at all, please have it checked out immediately. Another changes to look out for is changes in the nipple. Changes such as nipple inversion can also be a sign of a breast cancer. So nipple inversion is when the nipple actually goes inside instead of protruding out. So that is a sign of breast cancer and should be checked out. Also, if you notice breast discharge, it could be bloody, pussy, it's something to have it checked out. And personally, I think that if you're not breastfeeding or you're not pregnant, any kind of discharge from your breast is something that you need to check out with your doctor. Another sign to look out for is pain or discomfort in the breast. So pain or discomfort can actually be also linked to our menstrual cycle. So sometimes during the menstrual cycle or ovulation, you can actually have a little bit of pain around your breast, but it shouldn't be a severe pain. And if the pain is becoming severe or it's like localized in a particular part of your breast, it's something that you need to have it checked out as well. And most important thing with things like breast pain and all of that is something that if you haven't really been noticing these symptoms, and then suddenly from nowhere you start having breast pain somewhere, is something that you should be worried about as well. Certain risk factors actually increase the likelihood of somebody actually having breast cancer. Things like um, family history of breast cancer, women that are over 40 years old, lifestyle choices such as smoking, drinking can also increase the likelihood of breast cancer. But however it is, it's important for men and women to actually be on the lookout for. So for women above 40, they are encouraged to have mammogram, do self-examination of your breast, and also any of these changes that I've mentioned, if you notice them at any point, just have it checked out. Don't assume anything until you've been given a definite answer that this is nothing. Then you can say, oh, this is nothing. If you found this video helpful, please give it a thumbs up and please subscribe to the channel. And the most important thing of everything I've said is to always listen to your body. If something doesn't feel right, it doesn't feel right, please contact your healthcare professional to have it checked out. Thank you guys for watching. Bye bye.